Low sexual desire in women. Many women experience low sexual desire, low libido, at some point in their lives, yet it remains one of the least discussed topics. Low libido is not always caused by hormonal problems. Stress, anxiety, depression, relationship difficulties, certain medical conditions, medications, poor sleep, and lifestyle factors can all play a role. In this article, we explain the common causes of low sexual desire in women, how it differs from hypoactive sexual desire disorder (HSDD), the risk factors to be aware of, and when it is time to seek professional help. Low sexual desire in women, sometimes associated with hypoactive sexual desire disorder (HSDD), can result from a combination of physical, emotional, and relationship-related factors. According to Health Direct, hormonal changes during perimenopause, menopause, pregnancy, and breastfeeding can all affect sexual desire. Physical causes may include low estrogen or testosterone levels, arthritis, coronary artery disease, diabetes, and certain medications such as SSRIs, selective serotonin reuptake inhibitors. Approximately 1 in 3 women will experience low sexual desire at some point in their lives. Identifying the underlying cause is essential to finding the most effective treatment and restoring a healthy libido. What causes low sex drive in women? Low sex drive refers to a reduced interest in sexual activity. If you are experiencing this, it is important to understand that many women go through it at different stages of life. For some, it lasts only a few weeks, while for others it may persist for months or even longer. There is no single cause. Sexual desire is influenced by many factors, including physical health, emotional well-being, hormones, relationships, and lifestyle. Common causes of low sexual desire in women. Hormonal changes. Hormones play a major role in sexual desire. Pregnancy, childbirth, breastfeeding, and menopause can all change a woman's libido. In some cases these changes are temporary, while in others they may last much longer. Stress and mental overload. Modern life places many demands on women. Daily responsibilities, work pressure, childcare, and financial concerns can leave little emotional or physical energy for intimacy. When the brain is focused on coping with stress and survival, sexual desire naturally declines. Emotional health. Psychological conditions such as stress, anxiety, depression, or emotional burnout can significantly reduce libido. A mind under constant stress often struggles to maintain interest in intimacy. Relationship problems. Poor communication, unresolved conflicts, lack of trust, or emotional distance in a relationship can gradually weaken sexual desire. Not every case of low libido is caused by a medical condition. Relationship dynamics can also play a significant role. Medical conditions. Certain health conditions, including thyroid disorders, hormonal imbalances, chronic pain, diabetes, and other long-term illnesses, can affect libido. Likewise, some antidepressants and blood pressure medications may reduce sexual desire. Can low sex drive occur without a serious illness? Yes. Not every case of low libido is linked to a medical condition. Lifestyle choices alone can have a significant impact. Poor sleep. Lack of sleep does more than cause fatigue. It also disrupts hormones, affects mood, and can reduce sexual desire. Physical exhaustion. A heavy workload, chronic fatigue, or lack of regular physical activity can leave the body too tired for intimacy. Body image issues. Some women feel dissatisfied with their appearance or physical features. Negative body image can lower self-confidence and reduce sexual desire. Lack of emotional intimacy. Feeling appreciated, emotionally supported, safe, and connected with a partner plays a vital role in maintaining a healthy sex drive. Low sex drive versus HSDD. Are they the same? No. Every woman has a different level of sexual desire, so it is important not to jump to conclusions. Low libido is a symptom or experience, while hypoactive sexual desire disorder (HSDD) is a specific medical condition characterized by persistently low sexual desire that causes significant personal distress or relationship difficulties. Not every woman with low libido has HSDD. The diagnosis requires that the loss of desire is ongoing and has a meaningful negative impact on emotional well-being or relationships. Risk factors that may increase the chances of low libido. Several factors can increase the likelihood of experiencing low sexual desire, including pregnancy or breastfeeding, certain prescription medications, relationship difficulties, poor sleep, chronic medical conditions, hormonal changes with age, menopause, long-term stress, anxiety or depression, excessive alcohol consumption or smoking. Often, more than one of these factors may contribute to reduced libido. Can low libido be treated? The good news is that once the underlying cause is identified, treatment is often effective. For example, if stress is the cause, stress management techniques may help. If relationship issues are contributing, healthy communication or couples therapy with a qualified therapist may improve intimacy. If medications are responsible, discussing alternative options with your doctor may help. If the problem is hormonal or medical, appropriate medical treatment can improve libido. Every woman's experience is unique. What works for one person may not work for another. Therefore, identifying the underlying cause is the first and most important step toward recovery. When should you seek professional help? If your low libido has lasted for several months rather than just a few days, it should not be ignored. Likewise, if it is causing emotional distress or affecting your relationship, seeking professional help is recommended. Doctors, gynecologists, sex therapists, psychologists, and psychiatrists can all help, depending on the underlying cause. By reviewing your medical history, emotional health, current relationship, medications, and lifestyle, they can identify the reason for your symptoms and develop an appropriate treatment plan. Final thoughts. Low sexual desire in women is a common issue, and its causes vary from person to person. Hormonal changes, chronic stress, anxiety, depression, relationship problems, lifestyle factors, medications, and medical conditions can all contribute. It is also important not to confuse temporary low libido with hypoactive sexual desire disorder (HSDD). A brief period of reduced sexual desire does not necessarily indicate a medical disorder. The most important step is to identify and address the underlying cause rather than ignoring the problem. In most cases, early evaluation and appropriate treatment lead to a faster and smoother recovery. Low libido rarely disappears on its own without addressing the factors contributing to it.